So what are the results of this? Well, when we talk about on time, we're talking about results when you take your medication. And this is not really, and DBS for Parkinson's disease is probably not going to eliminate your need to take some medication. We like to lower your medication dose, but you're not going to come off your medication completely. So what happens? Before DBS, you may have 73% of the time, you may have either poor movement because the medication hasn't kicked in yet, or you're waiting for your next dose, or you've got the dyskinesias because the medication is kicked in and you've overshot that sweet spot and you're getting the medication side effects. And 27% of the time, you're doing pretty well. But it kind of flips it, so that after DBS, you're changing that good mobility time to 74%, and 26% of the time, you're in that poor mobility. And I think that's a pretty significant change. Yeah, I think most of you would take it. Now, how does it do that? Well, this gray graph here is the ups and downs that you have when you take your medication normally. So here, your medication hasn't kicked in yet. You take your medication, between here and here, you're doing pretty well. Then you overshoot and you get your dyskinesias from the medication. As the medication wears off, you're doing pretty well again. And then you bottom out again, wait to take the next medication, and the cycle goes all over again. So with the DBS, you don't drop down as low and you don't go up as high. And this probably is, and why it does that depends on where the electrode is. In the subthalamic nucleus, you don't get these peaks up here because we're going to lower your medication dose. In the globus pallidus, that's probably, the stimulation in this pallidus probably has your brain coping better with the side effects of the medication. But anyway, any way you look at it, you're going to get a more smooth response from your medication. If you look at off times, so times where people are off their medication, you also get an improvement. 87% of patients say that at the 1 year mark after this, they feel better even when they're not on their medication. So even though we say this helps the medication work, it's doing something similar to what the medication is doing. And if you look at the symptoms of tremor, rigidity, and akinesia or lack of movement, there's benefits at each time point, 6 months, 1 year, 3 years, and 5 years out. And some of these 5-year numbers are actually better than the initial numbers. If you look at akinesia, 50% of people are clearly better, 49% are clearly better 5 years out. So it's a lasting effect. With essential tremor patients, 69% have significant benefit. I think we're actually 90-something% of our patients are off medication. And so maybe this should be the first-line treatment for essential tremor if it's bad enough. And stimulation-induced transient tingling and slurred speech usually can be improved by programming. You can program those things out. So it's a great procedure. It works. And it works if you have accurate targeting, and it works if you have a team that carefully selects and screens the patients. You pick a bad patient, you're going to get bad results. Not that patients are bad, but their symptoms are not symptoms that are going to improve with the deep brain stimulation. Because it's reversible and adjustable, okay, so you're getting side effects, you can turn the battery off, or you can reprogram the battery. Deep brain stimulation is preferred over ablative procedures.